Hello, everyone. Welcome to the Glow Podcast. I have a very exciting guest here with me today. I have Meredith Hirsh from the Hirsh Center, and I know she has a lot of other ventures going on as well, which I'm sure we will get into. If you are new here, we are Tailored Marketing, and we partner with organizations in healthcare, longevity, and the wellness space to fuel growth through strategic marketing strategies. So if you are interested, drop a comment below. Meredith, thank you so much for coming on. I really, really appreciate it. If you would, I would love if you would just go ahead and give a little bit of an introduction so the listeners know who you are.
Well, Taylor, I really appreciate the invite, so thank you very much. I'm the CEO of the Hirsh Center, which is a practice that my husband and I started in 2007. I have a business background and he is a rheumatologist, and we specialize in rheumatology, and we recently added internal medicine. I also am a professor at Florida Atlantic University in the College of Business. I teach executive education and I teach in the medical health arena. I also have a podcast called Working Healthcare, where we
Amazing.
inner workings, of the American healthcare system, because you cannot fix what you don't understand. And while I believe that the American healthcare system is broken, I think everyone would agree with that. We still have the best system, but we can do much, much better. And finally, I do a lot of consulting and speaking engagements. So I speak nationally, I speak on the state level, I do a lot of work in the healthcare arena in general. And I don't really sleep. I think that's my new hobby.
You're like, yeah, no sleep for me. Let's see what else I can add to my plate.
I'm working on that.
Yeah, no, it sounds like you're doing a lot in the healthcare space, and that is so amazing. And so, I guess what kind of inspired you to get into healthcare? Like, has it always been something that you've been passionate about, or what did kind of that journey and path look like for you?
I had no desire to go into healthcare. In fact, I wouldn't even date my now husband because he was a medical student. I wanted to run as far away from it as possible. My dad's a doctor, my mom is a social worker, and my brother ended up going to medical school, and I wanted nothing to do in healthcare. I married a doctor. I said yes, and now fast forward, we just celebrated our 29th wedding anniversary, which is insane.
Wow, congrats.
Yeah, and he was working for another practice in rheumatology, and there were a lot of changes going on in the healthcare arena, and a lot regarding insurance and how to code and bill, and this is not a world in which I worked in. But I said, you know what? If you want to start your own practice, I'll set you up. Like, I'll set it up, I'll negotiate the contracts, I'll get a space, I'll help with the recruiting, and then you're on your own. And about 3 months in, his nurse called and said, so Tammy and Becky aren't here, and I'm by myself. And I said, why aren't they there? And she said, Dr. Hirsh gave them off on the same day. I can't do this by myself. Can you come in and would you manage us? So I joke in our office and say, if you don't like me, blame Elizabeth. She's still with us. And that's how I got involved. And I'm one of those people who, if I'm going to do something, I don't want to do it half-assed. I really want to work hard and learn all of the intricacies of whatever field I am focused on. I have a passion for it. And so the further I got involved in healthcare, the more I realized the challenges within the system. So almost 18 years later, now I'm a healthcare administrator. I guess that's my full-on title I'll accept.
Yeah, you're like, I didn't want to get into this, but I was more of just pushed into it, kind of. And I feel like sometimes, though, that's how the best things happen, is when it's like, it's almost meant for you, because it's like, okay, this path I didn't really write for myself, but here it is, and I'm gonna do the best that I can with the cards that I was given. And so you were talking too about, obviously, some of the challenges in the healthcare system, and from just talking to you so far, it seems like that's something that you're really, really passionate about. So when you kind of talk about those challenges, what are some of the main ones that you see?
Well, I've been very involved in advocacy efforts for several years now. And one thing that we could talk about is our broken health insurance system. Yeah. It's not pro-wellness, it's not proactive, it's reactive, and the Largest health insurer is United Health Group, and they are number 3 on the New York Stock Exchange. And they are focused on their shareholders, and they're focused on earning money in that quarter, and they're not looking at the long game. And so the patient is not put first, the physician is not put first, and patients are not getting the care that they need. And so denials are up the yin yang. I'm doing an amazing presentation on the future of Medicare Advantage plans. I like to call it Medicare Disadvantage plans. But doctors need to be in charge. Patients need to take responsibility for their health care. And we're facing a major physician shortage right now. We have physician burnout. We have something called moral injury. I interviewed Dr. Wendy Dean, and she talks about the difference between physician burnout and moral injury, and that doctors take on a Hippocratic oath to take care of patients in the best of their ability, and insurance companies don't allow them to do that anymore. I could go on and on and on about the challenges.
Yeah, you're like, there's so many. And I know insurance is, and I mean, obviously from a patient side too, there's so many challenges, but I think that a lot of patients don't look at it as well from the physician side, which also affects the patients, obviously. And so I guess like looking at it from the Hirsh Center, like how does it impact the practice as well with these challenges with insurance?
Well, when we started our practice in 2007, I didn't know anything about billing and coding, and we outsourced. About 3 years in, took over the billing and brought it in-house. We had one person. We now have about 2 billers, coders, and the doctors and providers actually code themselves. Those who help with the coordination of care, those who help with prior authorizations. We have about 2 per 1 provider.
Yeah.
It's besides the clinical team supporting, it's probably on par with staffing regarding hands-on the clinical team. So it definitely impacts us. I'm dealing with a patient right now, and my heart breaks for him. And his insurance company wants him to get a complex biologic. He has rheumatoid arthritis at home. Now, Remicade, which is the brand name from Johnson & Johnson, is an infliximab, and there are other different biosimilars that could be infused as opposed to specifically Remicade, but it is not a drug that could have no side effects. So the potential side effects could be great. I'm on the business side of medicine. I'm not on the clinical side of medicine.
Yeah.
But what challenges me so much is the insurance company only wants this patient to be on a self-injectable, and the person is morbidly obese and needs to be on a weight-based drug, okay, because we're going to get the same effects. The person has already failed 4 different drugs for rheumatoid arthritis. And if we do actually get an infliximab approved, the insurance company is requiring the patient to have a nurse infuse the patient in the patient's home. That does not make sense to me.
Yeah.
When the patient is infused in our practice, we have a doctor on staff all of the time.
Yeah.
So you're putting a patient at risk in that situation. So this is how it affects our patients. This is how it affects our entire practice. This is how it affects our providers. You're causing a rift, not you, the insurance company is causing a rift between the patient and the provider.
Yeah. And what is the benefit even like of that for the insurance company? Is it primarily just financial based?
Financial. That's it. Money.
Yeah.
And if care is denied, well, then you've saved money, right?
Yeah.
And if you can negotiate, because there's something called PBMs, pharmacy benefit managers, which are typically owned or own the insurance company. There's so much vertical integration that the insurance company is also the pharmaceutical company, is also the pharmacy benefit manager, is also the supplier, is also the claims adjudicator and the claims processor. So you have this massive vertical integration, and it's all about money in the bottom line.
Yeah. Like you said, they're number 3 on the stock market, you know? Yep. So it's like, it's so financial based. And I think people are starting to see that more and more, kind of like where the motivation lies and all of that, but it's also like what can we do about it? You know, there's not much as an individual that you can do. I guess, do you have some sort of solution that you think would potentially work for this? Or like if you could wave a magic wand, what would you kind of do to fix this issue for patients and providers too? Because I know it affects providers as well.
I love that you asked that. I always end my podcast with, if you could create one change within our American healthcare system, what would it be? Because there are some items that need to be changed. I used to have a magic wand. So I try to grant people wishes. You know what? I think it's really complex, but what can individual people do is they can speak up.
Yeah.
If you feel that something is unjust, speak up. Talk to your politicians, talk to your state legislators, talk to Congress, get involved, speak up. It's what I do. You also have to give money to the political action committees involved, whether it's locally for me, it's the Palm Beach County Medical Society, and then it goes into the Florida Medical Association. We have our conference that starts tomorrow, and then it goes to the American Medical Association. Not a huge fan of the AMA. I think they get a little focused in the wrong area, but our state organization is very, very strong. We also have national organizations that are working to fight and protect doctors as well as patients. But the golden rule is the one with the gold makes the rules. And so if you have an insurance company who hires full-time lobbyists to go onto the Hill and to work with Congress, how are you going to combat that? You have to be able to tell your story. You have to build relationships with people who are making these rules. I'm really proud of Sarah Huckabee Sanders, who is the governor of Missouri, and she created a law, because Congress hasn't done anything about this yet, but she created a law where the pharmacy benefit manager cannot own the insurance company and vice versa. So she said, you know what, if our U.S. Congress isn't going to make a law regarding this, I'm going to do it in our state.
Yeah. No, and I think, you made such a good point. It's like it is about the laws and what they're able to do. Because right now we don't have any laws that are necessarily, prohibiting these things from happening, and the insurance companies are able to get away with it. They have no one that's stopping them from doing these things right now.
I misspoke. She's not the governor of Missouri. She's the governor of Arkansas. But she is trying, at least on a smaller scale, to make a difference. And, I'm a big believer, Taylor, in just doing the right thing.
Yeah.
Do the right thing. What is the best thing to do? Do the right thing. We will all prevail if you do the right thing.
Yeah. No, for sure. And as obviously you're more on the business admin side, but as a business admin or healthcare professional, or even as a doctor, is there anything they can really do to help patients, or not really with the insurance problems?
100%. I'm working with a company called Claimable, and I actually interviewed the CEO. His name is Waris Bakari. He's a doctor who left medicine, and he created a company that fights denials with AI. And so it is a way for patients to go through the process and get help, because most people do not fight their denials. Do you know only 1% of people fight denials?
I think it's because people think it's going to be so expensive, because they think, you know what I mean? They think it's going to be, or they don't have the time. It's, yeah, exactly. Or they don't know. You're right too. But I think a lot of people, they see people that are going to court with their insurance companies because they were denied something that they need, and they're like, oh my gosh, if I have to do this, it's gonna drain me. It's gonna be more than me just not getting the medicine or the procedure or whatever it is that I need.
Going back to even look at the patient of ours who is, we've been working with this patient for several months now, and he's still not on a biologic for his rheumatoid arthritis. And once you burn down the house, once that joint gets destroyed, there's no way to fix it. You can't go back and rebuild damaged wood, right? If you're building a house, my husband likes to use that as the analogy. And I think it's a really great descriptive analogy. And so delaying treatment for these patients is going to cause long-term damage or death.
Yeah.
And it's just not the right thing to do. And there has to be a way, going back to what can we do? We can speak up. We can fight for what's right. We don't need to gun down the CEO of United Healthcare, which is what happened in New York, right? But we can do things on a positive, proactive basis by communicating and sharing the truth. There's social media now out there, which is a huge avenue to be able to express, if you're a patient, what happened to you? If you are a doctor or you are a healthcare administrator, what are the stories that you can share to spread the knowledge and to let people know this is really going on, or what we can do to help patients? It's very difficult. We're 20% of our national GDP.
Yeah.
What are we doing with $5 trillion?
Yeah. No, it's a good question for sure. And I think you brought up a really, really good point with social media too, and just all of the access to information and knowledge that we have now. If you are going through something similar, then it's beneficial to share your story, because I'm sure if you share your story, then there's going to be people that are commenting like, oh my gosh, I went through the same thing, and then you can start this process of advocating together, and then you don't feel like you're alone, because I think a lot of these people too, they probably feel like they're alone. Like, I'm the only one who's had to deal with this. Like, why is this happening to me? But if you can talk to other people who are going through similar things, then it makes you feel like you're not alone, kind of.
It almost feels like a personal rejection when you get a denial.
Yeah.
Or it makes you question, I've heard this from patients, makes you question, did the doctor really provide the right diagnosis and the proper treatment? Why is the insurance company denying this? And it breaks the trust between the provider and the patient. And so being able to share and air these concerns, there are great influencers right now. You're doing a great job, or at least interviewing me to find out what's going on in the American healthcare system and what can we do to fix it. And I do that every week. I got involved in the podcast because I actually had won an award from the Florida Medical Association on helping physicians practice medicine. And the keynote speaker was Will Flannery, and he is a doctor, and he started a social media, like little short videos called Dr. Glaucoma Specialist. And he said, what'd you win this award for? And I said, helping doctors practice medicine. He said, what do you do? I said, I write letters, I go to Tallahassee, I go to DC. He's like, you need to be on social media. And I said, really? Social media? Like that? I don't know if that's really my generation. I'd say millennials and the Zoomers rather. But me, I'm like, oh, I don't know. I'm not a very patient person. So all of a sudden I created this alter ego because I did not want insurance companies to say, oh, well, look what Meredith Hirsh is doing, and let's screw over her doctors and her practice.
Yeah.
I actually got banned from TikTok.
For what?
Sharing the truth. But what was the reason? The reason was spreading misinformation. But I guarantee you it was because of Florida Blue or Aetna or Cigna or United Healthcare, who has a lot of money and a lot of power, and got me kicked off. And the person who created the videos with me said, Meredith, it's fine. We'll just take it down and then we'll start another one. And he's like, I do this all of the time. I said, there is a problem with having to do that all of the time.
Yeah.
And I don't want to be an actress and create SNL skits. I don't want to be an alter ego. I want to be me and share the truth and the information. And I had several people say, you need to start a podcast then. You know too many people in healthcare. You know a lot of leaders in various aspects. Like, why don't you just interview people and help uncover what's going on? And you know what? That's only me. If everybody did a little something who was in this field, it's amazing what we could accomplish.
Well, everyone has different expertise too. And the thing I love about podcasts is you get to the real root of things, and you can talk for longer than just 90 seconds, on social media, that it's just like little tidbits and stuff. And during this half an hour, 20 minutes, you really get to like talk to somebody, and we've talked about so much already. I think that that's great too, that you're doing it as well, and like you're not just preaching, but you're really, really walking what you're saying.
I do. If you're going to do something, do it right. My kids will tell you I say that all of the time, even if it drives them berserk. If you're going to do something, do it right.
Yeah, no, definitely. And then you're also teaching too to the younger generation, so that they kind of understand as well what's going on, and so that they can also be a part of that change that we want to see in the healthcare system, and really in the world too.
And that's the goal. I teach executive education, so I teach a whole plethora of the generations. I have doctors in my class. I have those who are new into healthcare, so it covers the entire gamut, and I focus on the operational side and workflow side, and I do talk about the history of health insurance in America, which is always a really interesting topic. I'm pivoting next year, though, and I'm teaching in the Masters in Healthcare Administration program, and also doing my various lectures and getting involved with those who are boots on the ground to be impactful for their careers, right?
Yeah.
This is our career. You're in the marketing field in healthcare. This is your career. If the system is not functioning well, it impacts your body.
Everything. Yeah, everything, really. And it's like, no, I completely agree with you. And I've heard too, even from people that I've talked to recently, some doctors that like are switching to almost like a self-pay or like concierge service as well, because just they've seen so much denial for patients, and it ends up sometimes being, depending on what you're treating and everything, it can be more cost effective with a self-pay method even as well. Have you seen kind of the same shift in the market, kind of depending on the industry?
Well, we're in South Florida, so in our area there's a lot of competition, and we in our area is actually where MDVIP originated. So it is a concierge internal medicine group, and I interviewed Dr. Rob Colton, who was the person who started MDVIP, and we talk a lot about how it started and where it is today, which is unbelievable how successful it is today. I've also interviewed a lot of other doctors in specialties. Neurology is another one where there is concierge or pay as you go, right? Or a membership type of service. With our internist, we are only on Medicare with the internist who joined our team, and he was in the community for about 20 years and realized he is not running his own practice anymore. And he came to us and said, listen, I know you guys know how to run your practice. I respect the type of medicine that you practice. Can I join your team? And we can't negotiate great rates right now, and anything that even approaches Medicare reimbursement, and by the way, Medicare reimbursement is pretty crappy anyway. We've had a constant decrease since 2000. And so we only accept Medicare. He has a lot of patients who just pay cash. And if you think about it, if you don't have health insurance, you definitely need something like catastrophic health insurance. But if you need internal medicine and you want to just pay as you go, it's going to be less expensive actually than probably having insurance where you have a huge deductible to begin with. If you are younger, there are a lot and you are put on, let's say, a biologic or an expensive medication, there are opportunities to get that assistance through the pharmaceutical companies, and you don't have to go through your insurance. So there is a change going on right now in the system regarding insurance or concierge medicine or pay as you go or a membership type fee, and I really think it's going to avalanche sooner rather than later.
Yeah, no, for sure, because I think people are definitely seeing kind of the challenges with insurance like we've talked about, and seeing the advantages of not having to deal with that.
And a lot of doctors you want to go to where they're out of network.
Yeah.
My son, my oldest, is in New York City, and he needs to go to a specialist who doesn't take insurance.
Yeah.
And, and what I think is interesting, I want to share, and I don't think people are aware of this, is you may have out of network benefits. For me, we're on Florida Blue, and I have out of network benefits. So if my son went to this doctor who charged $500 for a new patient visit, I could go ahead and submit the $500 bill with all of the coding to Florida Blue. But
Yeah.
Florida Blue would not give me $500 toward my deductible. Florida Blue would give me their reasonable and customary reimbursement for those codes. That code might only get reimbursed $110. So while I paid $500, I only have $110 toward my out-of-pocket costs. And then my individual out-of-pocket responsibility is $6,000. So how many visits is he going to have to see to reach $6,000, where my insurance company again then will only pay $100 of the $500?
Yeah.
Start thinking about it, maybe we're overinsured and not getting anything, and all of the profit is going to the insurance company because they can't negotiate competitive rates for people to keep their doors open and stay in business to take care of patients.
Yeah. No, and that's such a good point, honestly, because I feel like we're not educated about how insurance works, especially if you're not working in healthcare. Like, you really don't understand, like, okay, how does that work? How does my deductible play in? Like, how much am I going to pay out of pocket? And am I going to have to pay the full amount until my deductible comes? And then when that does come, is it ever going to even?
I know. I don't think I've ever had my out of network kick in.
Yeah.
Never. And it's very difficult you can't get a child psychiatrist in my area in network with an insurance company. They don't need to. And there's such demand and there aren't enough. We have a huge physician shortage. So we're seeing these challenges time and time again, and it's becoming more catastrophic care. I know there's a better way to do it. There are a lot of different players and a lot of different aspects that need to be rejiggered. But I think if people came in with more of a let's do the right thing mentality and trying to fix it that way, what makes sense? What is the right way to do this? I think everyone could benefit. The patient, the physician, our entire healthcare system, the insurer, administrators, pharmaceutical companies. We're responsible in America for 70% of the drugs that are manufactured.
Wow.
Not manufactured, rather, I should say, created, developed. Yeah. And the reason why we're a capitalist society, and if you're going to put the money into R&D, you want to know that you can reap benefits and there could be a windfall down the road. I get that. But there has to be a way to continue to provide that opportunity while still supporting patients and the healthcare community.
Yeah, no, I completely agree with you. I think that that's really, really important. And yeah, if more people were just focused on doing the right thing, it's like we don't have to stop making money. Because that's what everybody's worried about. But it's like, if we're focused on the right thing, we can still make money, and it'll probably feel better too.
Yes. Well, it's interesting because we talk about what happened with the Affordable Care Act, and health insurers were required to spend, I don't recall if it was 70 or 80% of the premium on the patient. And if that amount wasn't spent on the patient, then the money needed to be refunded to the person who paid the premium. It wasn't the full amount that needed to be refunded. So to make it easy, $100 you pay for your premium, and you're required to spend 70% of the $100, so $70, and instead you only spend $50. So you have this 20% discrepancy. You only have to pay back 10% of the discrepancy.
Wow.
Who cares that you're not spending the money?
Yeah.
Because it still is a financial windfall for the insurance company. The ramifications are not are not penalizing enough for insurance companies to even do the right thing.
Yeah. No, it doesn't even make sense.
No.
Like when you say, it's like what is this, what does this even mean then? Like, why do we have this in place if it doesn't make sense? But a lot of things I feel like don't make sense that we have, but again, like a lot of people just don't understand how it works, because like I didn't even know that, and if you don't understand, then you're not able to really object to it.
And the problem is, Taylor, really, does everybody need to understand this? I think the people in the trenches and inside, and RFK should really understand it, but he doesn't.
Yeah.
Regarding, Health and Human Services, because he's the top dog there. The people inside need to understand. Patients shouldn't have to deal with this. And if people on the inside just did the right thing and did what made sense, we wouldn't be in this situation.
Yeah, no, I think that's such a good point. And so I guess my last question would be, what are kind of goals for you for the Hirsh Center? Obviously, I know you have speaking as well as your podcast. What does kind of the next year look like for you?
My goal is to continue to grow physicians and support our community. Florida is growing vastly. The mayor of Boca Raton, and we're in a city just north of Boca Raton, just invited all of New York City, after they decide to vote in a communist mayor, to come down to Boca Raton. So we will be flooded. Let's see what happens. But my goal is really to continue to take care of patients and our entire healthcare team, and to provide the most optimal service and care in our community, and continue to grow, because on the business side, if you're not growing, you're closing shop. So I'm focused on the growth. I'm focused on building and continuing to build a strong team and bring on doctors and take care of our community.
Yeah.
I'm going to fight to do the right thing.
That's awesome. I love that. It has been such a pleasure talking to you. If you would tell my audience, what is the best way to find you? What is the best way to find the Hirsh Center? I'll also include all the links in the show notes as well.
Thank you. So the best way to find me or to reach out to me directly, I have a website, meredithhirsh.com. So it's meredithhirsh.com. They can also follow Working Healthcare on any podcast platform, Apple Podcasts, Spotify. We also have videos now on YouTube. We posted our second season on YouTube, and I'm available on LinkedIn. The Hirsh Center is thehirshcenter.com. Gosh, I think I'm all over social media. Google lists me as a public figure at this point. So I'm like, oh, great.
You're probably on ChatGPT too.
Check that out. You can check that out for me.
I will. Well, thank you so much for coming on. I really, really appreciate it.
Thanks, Taylor. It was great.